The American Cancer Society recommends patients get regular colorectal cancer screenings at 45. But if patients are at higher risk for colon cancer, they should start screenings earlier at age 40. To explain who this higher risk group is, we actually have the expert in the house, Dr. Roland George. Thank you so much for joining us. I really appreciate all the work you are doing over at Baylor College of Medicine. So let's go ahead and start off first with, who is this higher group that we're talking about here?
Yeah, so everyone should get screened for colon cancer. And you're right, the blanket statement is to start screening at 45. But there are some higher risk groups out there. So the higher risk groups are predominantly those who have a family history of colon cancer, especially first-degree family members with a history of colon cancer, especially before the age of 60. Those patients should get screened earlier at 40 or 10 years prior to the diagnosis of their first-degree family member.
Okay, so I've read a lot about high processed foods and colon cancer. Is that really leading to a rise in cases around the area?
So we're not exactly sure what's contributing with certainty to the rise in increased rates of colon cancer, but it is thought that diets that are low in fiber, high in fat, and especially higher in amounts of processed or ultra-processed or preserved foods might have a component in changing the lining of the colon, making colon cancers more likely to occur.
Oh, okay. I've never heard of that. It's changing the lining. Oh, okay. All right, so now let's talk about the screenings. We talked about 45, maybe 40. What's the first step in getting to that screening?
So the first step is seeking care either with your primary care doctor or a gastroenterologist. And especially if you know that you have an increased risk of colon cancer, including a family history of it, you should let your primary care doctor or your gastroenterologist know that. Patients who are at high risk of colon cancer, really the ideal screening test of choice is the gold standard test, which is the colonoscopy. There are some other non-invasive tests out there, which are stool-based tests, where you either collect a stool sample or whole stool sample. And those are fine for patients at average risk screening, but if you're at a higher risk, you really should be pursuing a colonoscopy.
Okay, and also on your website, I went to the Momentum page, and they have a couple of key things we can do to prevent colon cancer. Now, with less than like 10 seconds, can you give us like those 3 things that we should be doing?
Yeah, so absolutely. So colon cancer you should think of is one thing that, irrespective of your risk or trying to prevent it, does still need to be screened for. You can do